All right, so the last part of our systems unit covers health insurance plans. This is where you're going to see a lot of your test questions pulled from, but it is somewhat of a difficult concept for some people because there are so many different terms as far as the financial aspect and then understanding how to calculate those different costs. So we've talked about a lot already that healthcare is extremely expensive and the cost is a big concern for a lot of people. We know that our healthcare expenses are increasing and they're increasing faster than our costs of living. So they're increasing faster than our paychecks are increasing. Some people may not get yearly raises, or the starting pay rate may still be something like $8 an hour, but that doesn't usually allow for the opportunity for them to have health care because of how expensive the insurance coverage is. Most people we know rely on health insurance to help pay for these extensive healthcare costs. We're going to talk a little bit about insurance more in depth. So, healthcare plans or health insurance plans, usually in this description, we're talking about private health insurance. We see these offered by thousands of different companies. Blue Cross Blue Shield is one example. Aetna and Cigna are other examples. And it's important to remember that just because you have coverage with Blue Cross Blue Shield doesn't mean that your cousin has the exact same coverage with Blue Cross Blue Shield. They're going to offer different plans. It's going to be based on what the employer has chosen to offer for their employees. So just keep in mind that not all plans offered by each company are exactly the same. Like I said, we're going to talk about a lot of different finance-related terms. And the first is the premium. The premium is a fee that you, as the individual, pay out of pocket just to have insurance coverage. This fee is paid directly to the insurance company. Usually it's taken out of your paycheck. So, for instance, when I get paid twice a month, the cost for me to have insurance is taken out of my paycheck. It's money that never goes to my bank account and it goes straight to the insurance company. The district or whoever your employer is will pay for the other part that covers you having that health insurance. Once you have health insurance, if you have any expenses that are covered by the plan, the company is going to pay for those. Now, how much they pay and the services they cover are going to vary by plan and a little bit as far as payment by the time of year, and I'll get into that, or by how much of your deductible you've already met. So you're probably wondering, what the heck is a deductible? So this is the amount that you have to pay out of pocket before your insurance starts to pay. Your deductible resets every January. So for instance, if your deductible is $500, you have to pay out of pocket $500 before insurance starts to take over and starts to pay for part of your coverage or for your fees. Now, if it gets to be like September and October and you've paid that $500, then you'll now start paying a little bit less for some of the services, but that deductible is going to start back up at the first of the year. So that cost is going to go back up. Some plans have lower deductibles, like $500, and some plans have higher deductibles, like $3,000. So it really just depends on the insurance coverage that you have as far as what this fee is going to be. Coinsurance is how they split up how much insurance pays and how much you as the individual pay. This is always going to be expressed as a fraction. So our example here says 80-20 coinsurance, and that means that the company is going to pay 80% and you as the individual are going to pay 20%. So if the bill is $100 and you have to pay 20%, you're going to pay $20 for whatever that service is. And then the last thing is the copayment. This is how much you pay for a particular service no matter what. A lot of times insurance companies have a copayment that is specific to doctor's visits, and then a copayment that's specific to a specialist. So if you go to your family doctor, it might be $20 every time you go. But if they send you to a specialist for any reason, that might be $30 every time you go to the specialist. This is usually listed on your insurance information or on your insurance card. So just be aware that it doesn't matter if they do one thing or 10 things, your initial out of pocket cost is always going to be that $20. We're going to talk about two different types of insurance plans. The first is our health maintenance organizations, or HMOs. These provide managed care to help deliver our healthcare services. So you're paying a premium for membership into the plan, and that premium is going to stay the same regardless of how much healthcare you use. Depending on the plan offered, it's either going to be paid by you or your employer. Some employers cover insurance for their employees only, and then the employee may only have to pay for the family if they have family that they want to put on their insurance plan. The good benefit of an HMO, which we'll talk a little bit more about, is that they cover routine exams and preventative health care. Sometimes that preventative health care is not necessarily covered by other types of plans. And as we've talked about, it's cheaper to prevent something than end up having to treat it. So with everything, there's going to be advantages and disadvantages. Advantages of HMO, we have pretty ready access to healthcare. Like I mentioned, they're big into prevention, so you have that early detection and treatment option. And overall, individuals are typically going to maintain a better state of health. The disadvantage, which we'll also see with some of our other insurance options, is that you can only use providers that are affiliated with your HMO plan. If you go to someone who is out of network or not affiliated with your plan, you're going to have to pay either the whole thing out of pocket or a much larger percentage out of pocket to see that provider. Another type of managed care is our preferred provider organizations, or PPOs. We tend to see these in larger industries or larger companies where the PPO is going to contract with certain healthcare agencies, and then the employee is restricted to using those specific healthcare agencies. We tend to see that with this arrangement, that the company that's using the PPO can provide healthcare at a lower cost, which is going to be beneficial to them. Typically, these do require a deductible and a copayment, like we talked about. And if you use a non-affiliated or an out-of-network provider, you're going to have a higher copayment or coinsurance that could be somewhere around 40 to 60%. All right, while it is important to understand the difference between the HMOs and the PPOs, as well as the concept of managed care, a lot of what we're going to talk about is going to be distinguishing and understanding the difference between Medicare and Medicaid. So Medicare is a federal government program that provides health care for people over the age of 65, people with disabilities who have had Social Security benefits for at least 2 years, and any person that has end-stage kidney disease. How they chose kidney disease, I don't know, but these are the qualifications for people who are eligible for Medicare. Now, there are 3 different types: Type A, Type B, and Type D. Type A is going to cover hospital services. It's going to cover any care by extended care facilities or home health after you've been hospitalized. And it's going to cover hospice for people with a terminal illness. So it's true that not everybody that gets hospice services is older or over the age of 65, but this is potentially going to be a larger demographic that's requiring hospice care. So it would make sense that their insurance cover that care and services to provide them and make them comfortable. Type B is coverage for doctor services, outpatient treatment therapy, lab services, any other healthcare, the person does have to pay a premium. So that upfront expense just to have this type of insurance. And it tends to come with an 80/20 coinsurance. So Medicare is going to pay 80% of approved costs. You'll notice that says approved cost, while the individual pays the remaining 20%. And then Part D is the one that's going to assist with our medication expenses. We have talked in the past about how expensive medication can be, especially if you are someone with, as you've aged, you've got more medical problems and you're taking multiple medications for blood pressure or heart issues or diabetes. That's not something you want to try to cover out of pocket. Medigap. So Medigap is private health insurance that helps pay for things not covered by Medicare. It does require a premium. So again, that upfront fee just to have the insurance. To offer Medigap policies, they do have to meet specific requirements and then provide options that allow people to choose how much coverage they want to purchase. Now we're going to get into Medicaid. So one thing to remember about Medicaid is that it is jointly funded by the federal government and state governments. So it is a federal government program, but it is operated by individual states, which means that the benefits and the people that are covered are going to vary by state. So if you have qualified for Medicaid here in South Carolina and you move to North Carolina, you have to reapply for North Carolina Medicaid. It doesn't just transfer with you. So we see that each state is going to establish their eligibility standards, the type and scope of services they'll cover. They'll set their own rate of payment and provide their own individual programs. So remember, that's a big difference between Medicare and Medicaid. They are both federal programs, but Medicaid is operated by the individual states. Overall, the people that tend to be covered by Medicaid are those with low income, children who qualify for public assistance, and people who are physically disabled or blind. They do tend to cover hospital services, doctor's visits, long-term care, and some therapies. And then depending on the state, they may also cover dental care, eye care, and other specialized services. Workers' compensation is just what it sounds like. It provides treatment or compensation in a monetary manner for workers that are injured on the job. This is going to be administered by the state. Payments may be made by the employer and the state depending on the program. And what it does is provide payments. It covers your health care and your lost wages. A lot of times this may only cover like 66% of your lost wages. So that's something to keep in mind. But this should be an option to you. And this is why when we talk about documentation, why it's important to document everything so that if you come back later and you have an injury as a result of something that happened at work, you can go ahead and file for workers' compensation. And you already have documentation that the incident happened. There are some additional United States government plans. These are the ones that provide health care for all of our military personnel. So TRICARE is the United States government plan that provides care for all of our active duty members and their families, care for survivors of military personnel, and retired members of the Air Force and Armed Services. The VA, or the Veterans Administration, provides care for our military veterans. Managed care, we talked about a little bit when we mentioned our HMOs and our PPOs. Managed care was developed because of the known rising cost of healthcare. And here's where we're trying to provide that preventative care and early diagnosis of disease. So things like physical exams, well baby care, because babies need checkups much more frequently than we do as adults who only need to go about once a year if we're healthy. Immunizations, and then wellness education. Again, our HMOs and PPOs are going to be the main providers of managed care. And then the last thing we're going to talk about is HIPAA, or the Health Insurance Portability and Accountability Act. We will get more into this in another unit, but just know that HIPAA helps with providing guidelines for maintaining confidentiality of your healthcare information. It helps prevent healthcare fraud and abuse. It prohibits discrimination against an employee or one of their beneficiaries, someone who they want to cover based on health status. So the insurance company cannot refuse to cover you or a family member because of a previous diagnosis. And it requires standardization of electronic healthcare records in all of our different healthcare agencies. So that is just a down and dirty overview of insurance and some of the things that come along with it. We will, like I said, do some practice to make sure we understand breaking down the different fees and costs that come along with insurance. But if you have any questions, let me know. Otherwise, I will see you in our personal characteristics unit.